The H1B guy here, and today, the H1B guy reveals anxiety of H1B medical professionals and why S3599 Healthcare Workforce Resilience Act is vital. But before we get started, I'd like to ask you if you haven't already to please subscribe to the H1B Guy channel here on YouTube. It helps me to produce more content like this for you. I also wanted to mention that the H1B Guy offers a variety of consulting services. If I can help you or your employer with your case management, please reach out. I'd love to hear how I can help. In an article written by Praveena Jaidev for the journal Standard titled My View, Essential Immigrant Physicians Caught in No Man's Land. Quote, this spring, when COVID-19 cases swelled, Illinois set up field hospitals across the state and pleaded with medical professionals from across the country for assistance. As a physician in Rockford, I was especially eager to help at McCormick Center, a planned pop-up hospital in Chicago, but I couldn't. As a physician on an H-1B visa, I'm prohibited from working anywhere other than my hospital. To this day, as new hotspots flare up, I continue to receive urgent appeals to help, but every time I must decline. A physician working on H-1B visa is held to the same criteria as an H-1B working in any other specialty occupation. I've talked about the medical professionals on H-1B working on the front lines battling this pandemic. Here's an example of an H-1B MD that wanted to extend the battle lines outside of their place of employment and was unable to do so based on the requirements to have a certified labor condition application for each worksite. Back to the article. Quote, I'm one of 12,000 foreign-born physicians in this situation, and among 93% of international healthcare workers who say they would step to the front lines of the pandemic if they could, but immigration policy stands in our way. Not just our ability to address the country's severe medical worker shortage, but our own ability to put down roots and build lives in the country we call home. It's why my family is actively considering leaving the United States and taking our contributions elsewhere. Let that sink in. I was first introduced to this exodus when I came across at Pranav_Singh_MD, who shared his family's decision to remain in India due to the green card backlog. We simply cannot afford to let skilled doctors who are treating rural America leave the U.S. Think about the impact additional medical professional shortages on top of what already exists. Back to the article. Quote, it's a tragedy because of the shortfall of physicians is projected to reach 139,000 by year 2033, according to the Association of American Medical Colleges. That's why I'm part of Physicians for American Healthcare Access, which is backing the bipartisan, bicameral Healthcare Workforce Resilience Act. If passed, it would reallocate an estimated 200,000 unused green cards previously authorized by Congress. Of these, 15,000 foreign-born physicians and 25,000 foreign-born nurses would receive green cards. That's roughly a deficit of 13,000 physicians annually over the next 13 years. I've discussed S3599 over the past few weeks. During the H1B Guy breaks down Senate Bill 3599, Healthcare Workforce Resilience Act, I discussed the allotment of unused visas. The proposal was to go back to 1992 to recapture any unused employment-based visas and provide green cards for individuals working in Schedule A occupations and their dependents. Back to the article. Quote, the country cannot afford to lose doctors like me. I practice at Swedish American Hospital in Rockford, a safety net hospital that accepts all patients regardless of insurance or ability to pay. They drive hours from far-flung counties because we are their closest medical option. This is common. 135 U.S. counties lack a single physician, according to New American Economy. Dr. Jaidev, working in Rockford, Illinois, hits home with me. As a kid, I'd visit family that lived in a small town about an hour and a half from Rockford. It was the closest biggest city that had them all. For some reason, I always remember hitting up the Orange Julius that was there. The thought of a county in the US not having a single physician is really something that's just unfathomable to me. Back to the article. Quote, it hurts rural Americans who are forced to endure long wait times and rushed appointments. It hurts American medical professionals who are stretched far too thin. It hurts immigrant physicians like me who love America but live with mounting uncertainty. The mounting uncertainty comment really hits hard. I've had the pleasure of interacting and conversing with so many of you that radiate this exact same anxiety. It's palpable. It's also the same reason why my friend moved to Australia, and it's the same reason why Dr. Singh decided to stay in India. It's also the same reason the green card backlog and the use of H-1Bs as political pawns is impacting the health of thousands of individuals who have lived and worked in the US on H-1B visa for more than 10 years. This is also the same reason that Dr. Jaidev and her family are weighing their options. And finishing up with the article, quote, as the country surpasses 200,000 COVID-19 deaths, as hospitals brace for a second wave of infections, and as medical professionals increasingly sound the alarm about staff shortages, when you care for immigrants, you care for everyone. The closing sentence of the article really resonates with me. Our great country was founded by immigrants. Immigrants have played an important role in driving innovation and shaping our society. In a time when we should be coming together to fight the common enemy, we're instead targeting and alienating individuals that help solve real human capital shortages. This is why I'm a proponent of removing medical professionals, specifically Schedule A occupations, from the H-1B designation. If that requires the creation of an entirely new status, then so be it. For the full post, check out the H1BGuy.com. And I wanted to mention tomorrow night, 8 p.m. Eastern, I'm so excited to be joined by at dark_night 1587, known as wolf_dog, for the third appointment in the H1B Guy Live Stamp It Out. We're going to cover a variety of topics, including immigration journey, H1B discussions, S3599, S386, and immigration reform. If you haven't already, I'd like to ask you, please like this video, please subscribe to the H1B Guy channel here on YouTube, and click the bell for notifications. And again, tomorrow night, 8 p.m. Eastern. If you've made it this far, I just want to say thank you for watching my content. I really appreciate your support. The H1B Guy, your global source for all things H1B.